Health officials say Omicron will be in Austin any day now if it's not here already.
Austin Public Health says the unknowns surrounding Omicron led to a massive spike in booster demand over the last week.
KXAN's Brianna Hollis breaks down what to expect in Central Texas when it comes to the new strain.
Texans across the state should make a safe assumption that Omicron is here.
So far, Omicron has produced milder symptoms.
Viruses can, in the midst of pandemics, also, in essence, burn themselves out. And they do that by mutating in various forms that eventually fizzle.
But Dr. Mark Cassanova, part of the Texas Medical Association's COVID-19 task force, says this isn't necessarily signaling the end of the pandemic.
I think it's a little bit early to hang our hat on that, though.
Way too early to tell what's going to happen. It could go any way.
Austin Public Health says Omicron's official presence in Houston prompted a record week for booster appointments.
It's an unknown, and so it's best to, get fully protected as much as you can.
Especially, APH says, as people gear up to gather indoors for the holidays. That's why Chris De La Garza got his booster Tuesday morning.
I can take the opportunity to protect them and myself a little bit more. To me, it was a smart move.
APH isn't the only group seeing a spike in vaccine demand. Private vaccine group Point of Care Health says they're slammed.
We opened for public clinics 3 additional days this week when we would not have been open, just to support the community.
Health experts urging people to get vaxxed and boosted and say now is not the time to let your guard down.
At the end of the day, the more folks you have infected, the greater the likelihood of individuals becoming seriously infected with.
Brianna Hollis, KXAN News.
We want to let you know Austin Public Health is offering vaccines and booster shots at all of its clinics for anyone ages 12 and older. Kids ages 5 to 11 can get a shot at the Delco Activity Center and Sims Elementary School. Pfizer, Moderna, and J&J vaccines are also available.
Taking a closer look, a Houston wastewater plant discovered the new variant. It's part of what's called genomic sequencing. According to the Houston Health Department, they regularly test water to predict potential COVID-19 surges. In Austin, there was a similar program run by the University of Texas. It was put on hold earlier this year due to a lack of funding. With the Omicron variant now in Texas, the COVID hospitalizations on the rise now, we're examining how the different regions of the state are faring. 2 of Texas' 22 trauma service areas are reporting COVID hospitalization rates higher now than 18%. The vast majority of those patients are unvaccinated. The Texas Medical Association is urging unvaccinated Texans and pushing people due for their booster shots to get the shot before the holidays.
We continue to see a predominance of persons in our hospitals that are unvaccinated, ranges from 80 to 90+%. It's really critically important for those individuals that received Johnson & Johnson this year to understand if they're more than 2 months out, they're partially vaccinated. They are not fully protected.
Of those 16 million Texans who are fully vaccinated, only 3 million have received an additional booster dose of the vaccine. There are another 2.5 million Texans who received only one of their 2 initial Moderna or Pfizer doses.
The University of Texas clarified today they're not going to fire anyone over the COVID-19 vaccine. There was a little bit of confusion yesterday when the university said it would comply with the vaccine requirement for federal contractors. Today, UT says they will grant exceptions when warranted and will not terminate employees for not getting the shot. Today, a federal judge blocked President Biden's administration from enforcing a COVID-19 vaccine mandate for employees of federal contractors. It is the latest in a string of court victories for Republican-led states and others challenging a series of federal vaccine requirements.